Good afternoon, everyone, and thank you for joining our WNCT Now digital news update as we continue to track the coronavirus. Let me turn down these mics a little bit. My name is Kelsey O'Donnell, live here in our digital studio, and moments ago, the Pitt County Health Department wrapped up their news conference addressing the first confirmed case of the coronavirus in Pitt County. Now, Dr. John Silvernail addressed the media to start up front, and here's what he had to say.
Good afternoon, fellow Pitt County residents, response partners, and members of the media. This morning, we announced the first Pitt County case of COVID-19. We believe this case is related to travel and was not acquired locally here in Pitt County. This individual does work for Pitt County Schools, specifically North Pitt High School. He was in the school building on Monday, March 9th, 2020, and Tuesday, March 10th, 2020. While we believe the risk to students and staff is low, we would encourage individuals who were in the building on March 9th and 10th to contact their medical provider should they develop fever or cough. The incubation period of COVID-19 is 2 to 14 days. We are now at day 10 or 11, depending on the individual's date of exposure. Most patients become ill within 3 days of exposure. So if you're not ill now, the risk of becoming ill is fairly low, but not zero. I'd like to move on and update you about the number of cases in North Carolina and the number of folks we've tested here in Pitt County. In North Carolina, we have 97 cases. We have 1 case here in Pitt County at this time. We have tested in Pitt County a total of 51 individuals. We have 1 positive result, the result that we released this morning. We have negative results are 11 at this time, with 39 tests remaining pending. Some additional thoughts. While the arrival of COVID-19 in Pitt County may be unsettling, it also marks our first step towards the eventual resolution of this situation. I do not believe this will be our only case and fully expect that we will have more cases in the near future.
All right, our Katie Augustine is live in in Pitt County tonight, and she'll bring more details later on in our newscast confirming all of the cases. For other confirmed cases of the COVID-19, you can visit our website at WNCT.com. All of the latest information will either be pushed out via notification through cell phones or right up on our website. So also, Vidant Medical Center is on the front lines helping to fight this virus. They're providing action steps moving forward to help curb the further spread of the virus. Take a look.
Across Vidant Health, preparations for COVID-19 continue.
We know this is a historic event. We know how to respond to this because we've responded to other large events in the past, and we've learned from where this hit before us.
Part of that coordinated response includes increased visitor restrictions at Vidant hospitals, emergency departments, and offices.
We're doing this to limit potential spread, allow the healthcare workers to do their job.
Which patients can help support by knowing when to call your doctor or use virtual care and when to arrive at a hospital.
If you really have a real high fever, cough, chest pain, you're having trouble keeping fluids down, that's a real emergency. That's the patient that would benefit from going to the emergency department.
Even if you don't need care, now is the time to take action.
1, take this seriously. 2, develop a plan. Social distancing is the intervention that all of us can do to protect our loved ones in our communities.
Because protecting yourself and others requires everyone doing their part.
We need everybody working together to do what we always do, which is to improve the health and well-being of Eastern North Carolina, which is really a community discussion with everyone. And so how do we all come together to take care of Eastern North Carolina? And never has that been more important than it is right now.
In Greenville, Erica Mizell, Vidant Health News for 9 on Your Side.
All right, thank you. We're going to go ahead and take a quick break, and we'll have more coronavirus coverage coming up just after this.
WNCT-9 has one mission: to be on your side.
Right now, we want to ensure that you have the facts about COVID-19, the coronavirus, and how it affects all of us here in the East.
We'll have the latest information in our newscast on WNCT.com and on our mobile app under the coronavirus section.
WNCT-9 is on your side with facts, not fear. We'll get through this together. WNCT-9 is on your side with the facts about the coronavirus.
All right, and we are here back again. If you guys are just joining, my name is Kelsey O'Donnell, live in our digital studio. As we continue to track the coronavirus, we'll be bringing you the latest facts without fear, hopefully, like we just said in our promo, to provide all of this information for you all, the viewers. So earlier today, Governor Cooper addressed the media, confirming that the state of North Carolina has its first positive case of the coronavirus due to community spread in Wilson County. Now, what does this mean, you might be asking? It's that this person has not traveled and does not know who the positive case they did come in contact with in order to get the virus. So here was Governor Cooper earlier today.
This morning, North Carolina now has 97 positive cases of the new coronavirus, COVID-19. Our state lab has now confirmed our first case due to community spread in Wilson County, which means the person had not traveled nor been in contact with a known positive case. This is an expected but still unfortunate benchmark in this new pandemic. Expected community spread is one of the many reasons our state made difficult decisions to take early, aggressive action to slow the spread. The decisions we make and the actions we take now will help determine how we fare in the end. These are life or death decisions that government leaders pray that we never have to make. But when these decisions come, we pray for the wisdom and courage to make the right calls. We have to work to see around corners if we're going to combat this virus effectively. Our public health experts and emergency management team continue to prepare our medical resources to handle a surge in coronavirus patients. We are identifying additional facilities we can use as emergency medical centers. We are finding more protective gear for our healthcare workers. We're pushing out testing supplies and establishing sample collection sites across the state. I can't stress enough how much our state and the rest of the country will need the federal government to step up with testing supplies, equipment, and ventilators. We are managing our resources, and we are ahead of other states, but we can expect many more patients.
All right, and what you just saw was Governor Cooper earlier today. If you're just tuning in, he confirmed the first community spread case of the coronavirus in Wilson County, North Carolina. Now, moving back to Pitt County for just a brief second, Pitt County, Dr. Silver now announced earlier in his media briefing that Pitt County has had 50 Total 1 tests that have gone out since the start of this all. Only one has been confirmed positive at this time, and they have had 11 negative cases. They still have 39 that are out pending. However, they are expecting some of those to come back positive. This is not a time to panic. It's a time to just listen to CDC guidelines and continue to stay up to date on the latest news sources. So, that being said, this will wrap up our WNCT Now digital news update for the coronavirus coverage. We will have more coming up later on in our broadcast at 5 and 6 p.m. and as always online at WNCT.com. So thanks so much for tuning in.